His back is turned to us, right. That's Tom Emmer's backside. And I put that photo up for you this evening because that's what Tom Emmer is showing us tonight. In fact, you should know that tonight Tom Emmer is at a fundraiser in Sartell asking for money from people who buy his votes, maybe because we don't. In spite of the fact that we, through our taxes, pay Tom Emmer's salary, tonight Tom Emmer is showing us his backside. So I'm going to ask you a simple question. For you, is that okay? Yes or no?
No.
You can do better. Is that okay? Yes or no?
No.
It's not just that Tom Emmer is not here with us tonight. It's not just that he refused to meet with us. Actually, he never even responded to our invitation. On February 23, a few of us went out to Otsego to the 6th Congressional District office to meet with Tom Emmer, and we came unannounced, so we didn't assume that we would find him there, and we did not, but we were not disappointed. We were not offended because we just showed up. Well, we talked with the staff person. We said we would like to meet with Tom Emmer. How do we do that? And she sent us away with a card of the name and contact information for the staff person that we should contact to schedule him. So I came back here to the church. First thing I did was send an email to Kate Braun saying we would like to have a conversation with staff with Tom Emmer. Could you schedule that? A week later, on March 1, I got a response that said, I'm not actually the person who does the scheduling. I don't do that. And she included a link to go online to their scheduler, and she said, we'll get your request and you'll hear back from us. Well, guess what? I didn't hear anything. I waited a week, and after a week, I called and I said, I haven't heard anything. And I left a message because I didn't get to talk to a human being. I heard nothing, so I waited another week. So on the 16th of March, I emailed back with a long email saying, here's what's going on. I've not received even an automated response. Will we be hearing from you? And the following day, members of our team started sending emails, started making phone calls of their own. After dozens of phone calls, equally as many emails, we heard nothing. Well, actually, except for one response to a member's Facebook posting where they said, oh gosh, you know what you need to do is go to the website and request a meeting online. So I called back to the office and I spoke with someone and I said, so what do I do? And they said, well, you need to call his scheduler. And I was given the name of the same person that I called initially. And at that point, I was beyond frustration. I was absolutely irritated because there had been absolutely no response. Well, guess what? I'm tired of swallowing my frustrations, right? And I am outraged that we have been ignored because we never received even as much as I will get back to you. Right? We never heard anything like, it's possible. Never even, I don't like you people, you frighten me and I'm scared of you. Nothing. Absolutely nothing. Not a word. Is that okay? Yes or no? No. I agree. But what I want to tell you is that this is the message that is being sent to us. This is how much your representative respects you. This is how much your representative respects your places of worship, your spiritual leaders, and in fact, even his own office. Is that okay? No. Absolutely not. Now, you may have noticed that I have not, throughout what I've said, referred to Tom Emmer as Representative Tom Emmer, and I've done that for a reason, because a representative represents. A representative seeks to be in conversation with constituents, bare minimum, a representative acknowledges that his or her constituents exist. Tom Emmer has done not even one of those things. Not even one.
It has always been difficult for me to understand how in this country, with all of our wealth and technology, we've been unable to provide even the most basic of health services for all of our citizens. How in this supposedly Christian nation, we allow corporations and politicians to put profit before humanity. The question of healthcare is not just a financial one, it is also a profoundly moral one. Before the Affordable Care Act, the market for insurance was a Wild West landscape. Everyone was fending for themselves. In this market, the sick and the old were often unable to find coverage. The ACA put rules on insurance companies, requiring that they cover all applicants during open enrollment periods and eliminating their ability to deny coverage for pre-existing conditions. It also guaranteed that all insurance plans will provide the basic health services I mentioned earlier. These rules, along with tax subsidies for lower-income Americans and the expansion of Medicaid, have allowed approximately 20 million Americans to become insured. The American Health Care Act, proposed by President Trump and supported by Representative Emmer, would seek to eliminate the tax subsidies set in place under the ACA, which are based on local premium costs and income, and replace them instead with tax credits based on age alone. It would also allow insurance companies to increase their premiums based on age. This means that many Americans would get less help paying for their insurance premiums, and older Americans would be charged more. While President Trump and Representative Emmer have said that people with pre-existing conditions could not be denied coverage, it remains to be seen how premiums would remain manageable after also eliminating the requirement for everyone to purchase health insurance. In the most recent discussions, it seems that President Trump is also willing to get rid of the requirement for coverage of certain basic health services, like maternity care and mental health care. Unfortunately, this plan also reworks Medicaid, moving it from its current state, where the federal government pays a percentage of the program, to a block grant program. While many believe a block grant would be a benefit, when you really look at it, no matter how you slice it, it will be a cut in payments. This simply transfers the burden of Medicaid expansion back to the states. It leaves them on the hook for either cutting services or decreasing enrollment. The Center for American Progress estimates that in Minnesota's 6th congressional district alone, 89,000 people will lose their health insurance with the repeal of the ACA. That's a big number. It's hard to get your head around that many people. That number actually represents more than the combined population of the cities of Blaine, Lino Lake, Circle Pines, and Lexington. Let's think about it this way. Those 89,000 people are all individuals, just like you and me. They have hopes, dreams, families to care for. They're the elderly, the disabled, poor families with young children. This number means that each of these people will have to go without the health care that many of us take for granted. These are life and death issues that cannot be brushed aside over ideological and partisan differences. The ACA has opened up a whole world of preventative and basic health care services for many millions of people who have not been able to afford or have been refused access in the past. It's made a huge impact on these families and their overall health. Probably the most effective option for increasing choice and decreasing cost would be to have the federal government offer a public option. Federally run insurance would introduce competition, would provide a very cost-effective option for patients. For adults aged 55 to 64, this would be an early buy into Medicare. For younger Americans, it would be new. Why have we not heard of these options before? Why have some of these relatively minor fixes not been introduced into law and passed? Because Republicans in Congress, Representative Emmer included, have been unwilling to entertain any fix to the ACA other than outright repeal. We cannot go back. We need representatives in Congress who understand the life and death nature of these issues, who understand that the path for health care must be forward.
And I'm a mother to 2 daughters, ages 7 and 9, both on the autism spectrum. My children Together, they have 9 diagnoses, including autism spectrum disorder, ADHD, anxiety, sensory processing disorder. To give you an idea of our medical consumption, together our daughters have 5 therapy appointments a week. I spend 4.5 hours a week in waiting rooms, and we have regular medical and psychiatric appointments for medication checkups. We met our annual family deductible of several $1,000s within 2 months. These therapies my daughters need to learn to be self-sufficient and stay emotionally regulated would easily cost my entire salary for a year out of pocket. I am incredibly grateful for the Affordable Care Act. Do you remember what Dr. Cole just said about pre-existing conditions? Because of the ACA, insurance plans are no longer allowed to deny, limit, exclude, or charge more for coverage to anyone based on a pre-existing condition, including autism. And as far as I know, Democratic kids have autism and Republican kids have autism. This is a bipartisan issue. Many disabled children in the autism community receive medical services through Medicaid, so I really want to dispel the notion that Medicaid is a welfare story, okay? Medicaid services for elderly and disabled surpass those for low-income individuals. Cutting and capping Medicaid could have devastating consequences for children with disabilities like autism. If the ACA is repealed, states could decide that insurance companies no longer have to cover essential health benefits like prescription drugs and doctor visits. I'm going to end here, but I really want to say to anyone in any position of power who's listening, please do not cut or cap Medicaid services. These individuals who depend on Medicaid are some of our society's most vulnerable.
Many politicians, including our president, rolled into power this past year because they explicitly appealed to the racial fears of voters. Mr. Trump, in particular, did that using the issue of immigration. He spent months decrying immigration, describing immigrants as violent, criminal threats to our nation's security, and he got votes for it. One part of the electorate voted for him based directly on these racist appeals. Another part thought that these appeals would keep him from ever getting office. And a third part of the electorate thought for certain that once he got into office, he would cool it with all this immigration talk, all this hateful speech. But that has not happened.
What we're experiencing today as climate change is a reaction of the earth for our failure to heed the warning in Leviticus 18, verse 26, that calls us to be prudent in our decisions so that we would not defile our earthly environment. And I'm extremely concerned and fearful for the future of the planet Earth. These are the questions that we have that we would have asked Representative Emmer. We are called to care for God's creation. As a public official, do you hear that call? Will you vote no on any proposal to cut funding for the EPA?
So I have 3 kids. My oldest is a freshman in high school, my middle is a 6th grader, and my youngest is in 2nd grade. One of the things that we love to do is to road trip to national parks. But where we went last fall, we went to Florida last fall. We took the kids to Florida, and we did some of the standard Florida things, but one of the places we went to Big Cypress National Preserve, and we went to the Everglades. I'd never been to Big Cypress National Preserve before, but they had a fantastic boardwalk and interpretive exhibit that showed the impacts of sea level rise in that part of Florida. Now, we know what climate change is doing. Sea level rise has been noticeable over the last 30 years in Florida, and most of the Everglades and Big Cypress National Preserve is at 3 feet above sea level or lower. This interpretive exhibit showed the ecosystem, the environment. It showed what the water level was 100 years ago. It showed what the water level was with storm surges, such as from Hurricane Wilma. It showed what the projected water levels were in 50 years, in 100 years. Now, the 50-year level was pretty much even with the boardwalk where we were standing, which is elevated over the wetland. Back in the rental car to drive back to the house where we're staying. And she's kind of quiet, and you never know what goes through a kid's head. And just after a little while, she'd kind of been processing. And she said, "I remember that sign. Remember where the water is? Or where the water's going to be?" Yeah. "Well, what if I want to take my kids back there? What if I want to go back with my grandkids? If the water's over the parking lot, I can't take them there." And that broke my heart that it hit her, because that's one of the things that we do, that we love to do, that my parents did with me. And then she thought a little bit longer, and then with as much outrage and indignation as a 7-year-old strapped and buckled in the back seat could muster, she said, "But what are we doing about it?"
That when they asked me to talk at this part, this commitment, this call to action phase, my very first thought was, who am I? Who am I? Who am I if I don't? Who am I if I look around at this world and see so many things that are not the way I think they should be, that are not the way I believe God intended them to be? Who am I if I see that and I do nothing?